freckles cannot turn into melasma, and completely different thing. Single ingredients here, melasma ain't going nowhere. What is melasma? Why is it happening to you? What is the reason? What are the products which you should use? If you are interested in this video, keep watching. I'm Dr. Nancy, dermatologist. I used to make videos on skincare and makeup related contents. You can follow me in my Instagram and please subscribe. Melasma is a pigmentation problem where your cells producing pigment is hyperactive. They are producing more and more color. Pigment. This is called melasma, and it is completely different from freckles. Maybe starting of melasma, it will start as a small patch which will look like freckles, but freckles cannot turn into melasma and melasma cannot turn into freckles. They are both completely different things. You can see multiple blotchy brownish patch. It can be over your cheeks, over your nose, which is called malar distribution, and second is mandibular, over your jawline, and one is centrofacial. And depending upon the presence of your melanin, whether it's in your epidermis, dermis, or even mix. This is important to know because whatever treatment you are giving, if the pigmentation is in the dermis, that means the treatment is going to be not that much effective. Yes, it commonly affects female because of the hormones, and even in males, of course, it is there. And the age group is around 30 to 45 years old, but of course, you can get it after your 20s. Unfortunately, when we talk about melasma, it is not just simply your pigmentation. It's like two component. One is pigmentation and one is vascular component. Vascular component, what is the problem? Like for example, you are doing face steaming, you're under direct sunlight and some heat, or maybe you are cooking or your hair dryer or any form of heat, it will aggravate your melasma. So why do we get melasma? What are the causes? There are no single causes, so it is like multiple causes. For example, ultraviolet rays, hormones. As we said, it is more common in female because of estrogen, and drugs. You are taking oral contraceptive pills which contains estrogen. It can also have a genetic component. Your mom have melasma, so you have more chance of having melasma. Cosmetic ingredients, anything which can irritate your face, and also it can be mustard oil, it can be due to fragrance, and excessive stress. Stress is very important. When you feel stressed, your skin looks dull. So stress is very important part. And if you have any thyroid disease, you have 4 times more chance of having melasma. Thyroid disease, it can cause pigmentation over your skin, not only like the typical melasma. Regarding harmful rays which can cause pigmentation, there are ultraviolet rays, blue light which we are getting from like phones and laptops and all, and visible light, like the normal light, like literally the light, can worsen melasma. The important thing which I want to stress in this video is don't just randomly apply any skin lightening cream which you get from Facebook or online shopping site. You should know what are the ingredients, and there are some products which comes from Thailand or Myanmar which contains steroids, but they will not mention that particular steroids in the ingredient list, so be careful. They are known to have heavy metals as a skin lightening ingredients, so I do not suggest applying some random cream which your friends or your family suggest. Many people are using Skin Shine, Medicelic which contains steroid they are using for long term, and those things have serious side effects. It will worsen your melasma. It will give you something like acne, rosacea. It will tint out your skin. Your blood vessels will be visible. Your face will be itchy, dry, flaky, like WTF. I have a separate video talking about these side effects, steroid side effects in detail. Please go and watch them. There is no permanent cure for melasma. Even if you are taking treatment and your melasma have gone away, there are 75% chance of your melasma coming back. There is no permanent solution. You have to change your lifestyle, sun protection, use proper sunscreen, and other skin lightening safe ingredients. What are the things which we have to follow? Number 1, strict sun protection. Just because you're wearing sunscreen, that doesn't give you any permission to walk directly under the sun. Even if you're applying expensive creams and you're not following these sun protection measures, whatever cream you're applying or whatever treatment you're taking, it will not make any sense. It will not work. How will you select sunscreen? The best sunscreen is physical and tinted sunscreen. Physical sunscreens are the one which contains zinc oxide, titanium oxide, and the word tinted sunscreen means it contains iron oxide. Iron oxide is important because in melasma, visible light also play a role in the pathogenesis. You can also use physical and chemical sunscreen combination, but the problem with chemical sunscreen is when the ultraviolet rays hits your skin, they absorbs the ultraviolet rays ka energy, they disperse heat. So that is why they don't really prefer, but that doesn't mean that it is going to be like so bad. So, if possible, physical tinted sunscreen. Suncross SPF 50, La Shield Physico Sunscreen, Requil Sheer Zinc Tinted Sunscreen, Dr. Shad's Physical Sunscreen, Neutrogena, and Bioderma. I will leave the product description down below. You can check it from there. The sunscreen which you select should be at least 30 or more, and you have to follow that 2-finger rule for your face and neck, or at least 1.5 teaspoon. The sunscreen which you apply in the morning, it have lost its power after 2 to 3 hours. Even if the sunscreen claim that it gives 8-hour protection, you should still apply it every 3 hours or every 4 hours. Like for example, at least before lunchtime and in the evening before you go home. Don't think that you don't need a sunscreen if you are not going out. Ultraviolet rays can also pass through your window glass. It's cloudy, but you still have to apply. Whatever skincare you're using with single ingredients here, melasma ain't going nowhere. That's why you have to do proper consultation, and depending upon your skin type, your sensitivity, whether you're pregnant or not, there are so many other considerations which we used to think before prescribing a medication. Like I can suggest you one here, but maybe it will not work for you. So that is a problem in just making a video and suggesting some skincare products. There are certain creams which you can use for your pigmentation. You can select any one of these. Brista cream, Melaglow cream, you can use day and night. Kojic Glow Gold, which contains glycolic acid, you can use at night. Kojic Plus XT and Scarfix XT, these are containing tranexamic acid 10%, you can use at night. After applying all these creams and proper sun protection, proper applying sunscreen, when can you expect result? You can expect result after at least 2 months to 3 months. We never call the patients before 3 months because pigmentation, it takes a lot of time, and those products or some random skin lightening cream which are working so well, that means it will not be good for a long run. You have to be patient. You have to incorporate all these things as a part of your skincare. So that is all for today. Thank you so much for watching. See you in my next video.